Good morning, and welcome to The Real. I am Sarah.
I'm Leah.
I'm Kristen.
I'm Raven.
I'm Kathia.
And today we'll be discussing the issues of the health disparities among Black women.
So first, let's talk about this Flint, Michigan water crisis.
Girl, what is
it's
up
out
with
of
that?
control. Like, it's really
Ouch.
out of control. So we already know Black women, like in Flint, Michigan, are the breadwinners already. They,
Everywhere, but we can.
Well, yeah. We're just gonna talk about Flint right
Mhm.
now. 'Cause it's a lot. So you telling me I'm already going through.
Already going through.
And now I have to worry about sickness of myself and my children, and we can't drink water.
And it's the city that's causing this.
Then it's the city that's causing this.
I'm not too sure.
Like, I just don't understand. So 41% of the people in Flint are already impoverished.
Mm-hmm.
And then 56% of those people are Black. So you're going to take me in this area. I don't have water. So how am I supposed to cook? How am I supposed to clean? I have to buy bottled water. Like, it's just way too much. It's way too much. And according to Cornell Brooks, he said that it's environmental racism. How do y'all feel about that?
I feel like it is because they could have been did something about that water, and for the mayor to just not do anything and sit back and just let people drink that poison water really shows that he really don't care about those people.
Mm-hmm.
And by it being in the most low income part of Flint, Michigan, I honestly feel like he doesn't care.
Yeah. It just shows how much
Now, if it was,
money runs.
If it was in the rich white folks' place,
They
area,
would've got that.
Right.
Clearly.
Real fast. Like, they simply just don't have the money that you can afford to be sick in.
Mm-hmm.
You're already playing multiple roles. You have multiple strains on you as a Black woman. And that causes you to be more susceptible to illness, but not just any illness, but mental illness. And I don't want to be crazy.
Who wants to be the crazy Black woman?
Right, like nobody wants to be the crazy Black woman. We already have the stigma that we're angry.
Always.
And now you want me to be angry and crazy. And I don't want to go to the doctor. Right.
Angry, crazy, and sick.
To be angry, crazy, and sick. Like, I don't want to walk in the doctor's office and have that. Like, a lot of Black women already feel like if you're depressed, for example, then you have a weak mind, you have poor health, you got a troubled spirit, like you don't love yourself. And I don't want to be seen as any of those things. So I'd rather just not go to the doctor to be considered an angry Black woman. Just don't.
Because we are 4 times more likely to die due to pregnancy complications, you know? We are becoming the highest rate of HIV new cases. And then we're also, which is now the leading cause of death for women from ages 25 to 34. Then on top of that, you have half of the African American kids who are in single parent homes living with these Black women. Right. So now they have to worry about making less than white women, making not enough amount of money to make sure that their health is fine. Now they have to make sure that their child's health is fine. Yeah. So any typical woman, hopefully, is going to put their child before them.
Right.
Given. Right. So now you got to figure out, okay, I'm doing what I can to help my child. What about me?
Right.
So now these issues with Black women are going to continue to rise. As the Iron Triangle, access costs quality.
Right.
We're not going to have access if we don't have the money to get in that thing.
Right, because, I mean, to get the care needed, like, I know there were a lot of times as a child where I was sick, and my mom would just be like, "Go lay down."
That's all you can do.
You can't afford that.
Drink
right?
some water. That's the remedy for everything.
Right. Because even though she wanted to be there,
she couldn't. Right.
She
wants you to get the best care there is, but you can't.
Right.
Because she doesn't have the money to get the access to the good quality.
Right.
So even if you do have a little bit, okay, say if you do have access to it, depending on how much access you get determines the quality that you have. So if you only have a certain amount of money, you're only going to get a certain amount of quality.
Right.
So in order to get the best care there is, you have to have the max amount of money.
Right.
And considering the fact that you're making less than $1 to a man and a white woman,
Right.
how likely is that?
My grandma always said, "You pay for what you get."
You pay for what you get, and that's just how the circle goes.
Right.
Which is messed up.
Right. And although the ACA has been implemented, 55% of African American women reside in those states that have not expanded coverage compared to the 42% of white women. And in those non-expansion states, a large number of black women still don't qualify for the Medicaid program in place now. And most times, even if they do qualify for certain requirements, many black women in those states earn too much to qualify fully, but don't have enough for the subsidized insurance, thus leaving them in the coverage gap still. How do you feel about that?
So you telling me if I make too much, I can't get
You
coverage?
can't get enough, basically.
But if I make too little, I still can't get the coverage.
Right.
Like, what am I supposed to do? It's a lose-lose.
Right.
It's like, how do you make sure that you fall into those gaps? Because you don't want to just deduct your life
Right.
because you can't get enough healthcare insurance. So you're going to
So
try
now
other
I can't
options.
be successful.
Continue to drink water.
Right. Right. If I can't be successful, you too successful.
Yeah.
I'm sorry.
You know what?
There's not enough. Now I got to put a
You
cap
got
on
to
how
choose
much I want to
between
make.
success or health.
Right. Right.
You want to be successful
Right.
or healthy.
Right. Like, sorry, y'all. We can't make that much money. We can't.
Yeah,
I'm
sorry.
sorry. I'm going to have to get this job.
Your boss give you a
because
raise.
it's just
You know
enough.
what?
I can't take that
Can't
right
take
now.
it.
Can we cut
Not
that?
going to get coverage.
Like $10?
Companies who offer health insurance, they have these requirements as well. You have to be there for a certain amount of years,
Right.
work a certain amount of hours. They don't want people to be full time anymore. So they'll give you 39 hours so you won't hit that 40, so you can't be full time, so you won't get the
It's
coverage.
always something.
You better keep drinking that water.
Keep drinking water.
For 6 months. You'll be fine.
So let's go back to the topic of black women and HIV. So every 35 minutes, a woman tests positive for HIV in this country. Yet, the impact of HIV among black women and girls is even more startling. Nationally, back to what you said, black women account for 66% of new cases of HIV among women. Related illnesses is now the leading causes of death among black women ages 25 to 34. The virus that attacks the immune system and weakens a person's ability to fight infections. HIV is the affection that can cause AIDS affection among black women is a complex mix of environment, social, cultural, biological, environmental, and behavioral factors. HIV statistics.
Environment and
Where you are.
And if I don't have enough money, if I'm sadly trying to play mom and dad, and I don't have the money to make sure everybody is okay, which leaves me in the hole where I don't have like enough money to send my child to a place where they get the education early on about these
to learn
different
about
things.
STDs.
Right, and HIV and AIDS, then I'm left stuck. Like, how can I help my family if I can't help myself to help my family?
We can. You just have
Sad.
to pray and drink water.
Right.
Yeah. I know many people in the black household, they really don't discuss those topics, HIV, AIDS, and all the other sexually transmitted diseases. So that's probably another reason why young people, even not elderly, but adults, they go around sleeping with any and everybody. They catch this, they don't know what it is. They go to the doctor, and then they find out that they got this horrible disease. And now they looking and thinking about, oh, well, who gave me this or whatever. And now they looking crazy. And, you know, they ask the healthcare provider, you know, about that disease, and, you know, they tell them that they didn't really know anything about the disease, and it's because of poor lack of education in the household. It starts in the household first.
It does. It does. But if you can't have the quality, not necessarily quality education, but a quality education, sometimes depending on where you are and where you're living, because people are still thinking that HIV and AIDS is still a homosexual thing.
Right.
You know, that's not, it's not for homosexuals.
Right.
For some odd reason, people still think that's the gay disease,
Right.
when it's not even a factor in the gay population like it used to be anymore.
Right.
They've learned, they got it together,
Right.
and now it's
It's
just stuck in a circle.
Right.
But like you said, like it starts in the household, and culturally, like it's a problem in the African American culture. It's a problem. Like we don't want to talk about too much, because if we talk about too much, then people will feel like it's okay to do. Like
Right.
if I talk to my child about sex, then she'll
They're
feel
gonna have
like
sex.
right, like then you'll end up having sex because we talk so much about it. So
Right.
now it's a thing, and it's not a thing.
It's not a thing.
It's still not a thing.
Because people forget curiosity kills the cat, you know,
Right.
and that will never die. That will never die.
All the time. If you know better, you'll do better.
Holly.
Cultural competency is a matter of the patient's safety. It basically deals with how you should react to different cultures in the workforce, well, in a healthcare setting or whatever. In the African American community, they often are in denial. You know, when they go in for a medical diagnosis or treatment, sometimes they don't want the treatment. You know, sometimes they feel like, okay, well, this disease, like they don't believe that they have whatever they were diagnosed with. So you basically, being a healthcare professional, you basically have to, you know, give them the do's and don'ts, the rights and wrongs, and the only thing you mainly can do is just encourage them and make suggestions. You can't make a person take medicine or do this or do that if they don't want to. And as far as, do y'all remember the cultural competency quiz we had that one day? And there were like true and false questions. And I remember one question was like, by you being a healthcare provider, a woman comes in asking for birth control, but the husband, y'all remember that question?
Yeah.
But the husband, you know, yeah.
Before I left, I would be on the other side of the world because no.
Like, I feel like a man shouldn't determine what a woman should do with her body. Like, I feel like if a woman wants birth control to keep her from having kids, she should get it, and it should be confidential. But when your husband if your husband finds these pills, he's coming after you who gave it to him, and he's coming after the wife. So, how would y'all feel like giving a woman in a different culture that don't believe in birth control pills, like how do y'all feel? Do y'all feel like y'all are entitled to give her the birth control pills, or do you feel like she shouldn't give the healthcare provider shouldn't give it to him because of fear of her life and her clients' life?
That's a hard question.
Yeah, because dealing with that, I mean, the proper thing to do would be to just first talk to her, you know, just to make sure that this is something that she really does want to do. And if you don't feel comfortable, I would, you know, just refer her to somebody else.
Right.
You know, because if, you know, like if you really just don't know what to do, refer.
Right.
When you just
get personal.
Yeah.
Right.
Don't make it personal.
I
Let
would
them
make
know
it
that.
personal.
I mean, you, as a human being, it's kind of, and a woman, it's kind of hard to tell her, you know, right now I can't help you,
Right.
because it's just like, you know, you don't want to mix business with pleasure, because that's about emotions right there.
Right.
Like, you know, how can you tell me that I can't get this? Not only is her husband telling her she can't get that, but the government as well is toying with birth control and the access for women to have it as well.
Right.
So it's like, you know, can we do what we want to do ever?
Right.
Is there always going to be a limit to what we do and how we do it?
Which is like the example of like the Hobby Lobby case where, you know, it was the women who were talking about, abortions and, you know, preventative measures when it came to pregnancy. And it's like, right.
I'm just sad. If you just think about all that we discussed and all of us being Black women in this culture that we were just talking about, it's just like, you know, what's next for me?